So I'm gonna kind of start this video off um, talking about uh, just an introduction of the page. I'm gonna start doing these race and medicine discussions, um, just to kind of talk about how race um, has a very important influence on the outcome of health and the interaction between a patient and the healthcare system, and accessibility to health and wellness. Um, so yeah, but the first video today is going to be about sarcoidosis, um, in Black women in particular. Um, so yeah, and just a little bit more about the channel. It may come off as controversial to a lot of people. Every time Black people complain about things, or talk about things that need to be corrected that are harming them or killing them, uh, there's always backlash for whatever reason from all sides, from white people, from uh, Black people, from non-white or non-Black people. So I expect that to happen, but I will say that I've been in the healthcare industry for a long time. So I'm not. This isn't just something I'm making up. This isn't. These aren't things that I'm just. Um, it's not like I'm just on here BSing or anything. This is just based off of everything I've seen, everything I've experienced, everything that I've had to deal with. And the people around me that are Black have had to deal with. So, but I feel like it's something that most healthcare providers, most patients, most Black people, in just in general, don't particularly talk about, um, or sometimes even know about. So I'm going to give uh, my best assumption of what can be done to avoid certain things, or what can be done to deal with certain things. um but yeah, so that's basically the point of what I want to do. That I'm not going to really do much else on this channel. um but yeah, so about today's video, sarcoidosis in Black women. Okay, for those of you who don't know, sarcoidosis is basically they haven't really classified it as an autoimmune condition. I'm not sure. Um, it's definitely an inflammatory disease. It hasn't been found to be linked to any genes or anything, or any type of genetic component, which is interesting. Because it's like, well, then why do Black women get it at a disproportionately higher rate than other groups of people? Um, so what is it about Black women that causes them to get it, and why, or what are the things that can be done to treat it and things like that? Um, so I'm not going to go too much into the treatment of this. Um, well, you know what? Actually, uh, the fact that I'm going to talk about a little bit about what I believe, or what I found, um, seeing different patients and things, and from my experience, what I believe causes sarcoidosis. And I'll just start off with that. Um, as we all know, Black people, Black women in particular, tend to use tend to go to nail salons fairly frequently, at a higher rate than other groups of women and other groups of people. Um, and when you're in a nail salon, and they're doing your nails, especially an acrylic set or something, there's this dust that flies up when they do that, and there's all kind of chemicals in those polymers and monomers and things that they use to put the nails together and whatever. But and a lot of times you see the workers, they'll have their faces covered. Like a lot of times they'll have their faces like covered with like a mask or something, and it's like, but the customer almost never has her face covered. Um, so that's one of my theories, that those acrylic sets that you go to the salon and get, and you breathe in all those terrible fumes while you're sitting there waiting, and then while you're getting your nails done, and you're breathing in all of those really fine particulate acrylic pieces into your lungs. I feel like that's probably the main cause, because the thing is, there's no genes associated with it. There's no they haven't identified any genetic predisposition to the disease, so it's just something that tends to happen more frequently in Black women. Um and so I believe that may have something to do with it. Also, and I'll talk more about this when I get to the I'm going to talk about uterine fibroids, and I'll talk more about this when I get to that video. But there's actually a lot of research to suggest that hair relaxers actually can cause uterine fibroids, which um, fibroids are basically overgrowths of tissue, and type of a hyperplasia type thing, which as you can see in the diagram here, one of the characteristics of sarcoidosis is having growths in kind of it's not quite cancer, but it's an overgrowth of tissue. And they believe that hair relaxers and the chemicals that are found in hair relaxers, the chemicals in hair relaxers are probably a factor in women developing, Black women particularly, developing large percentages of uterine fibroids. And I feel like if it can, if they can think that hair relaxers can affect the uterus, obviously it can affect your respiratory tract and your head, um yeah, those are the two main reasons I believe Black women get it. However, you will not hear any medical professionals say that. You just won't hear them talk about that. You won't hear them make that correlation. You won't hear them and in fact, and this is kind of why I started this video. And this is one of the reasons why I know that it's going to be controversial. I know that it's going to be a problem for, specifically for non-Black medical professionals, because if any of you don't already know, uh, non-Black medical professionals, for the most part, they just they're I will say this. I'll say this. They're not immune to being racist or being uh you know dismissive or apathetic to things that happen to Black people, or or even wanting things to happen to Black people, or not wanting to help Black people and things like that. They're not above that. I just want to make that very clear, and that's kind of going to be a recurring message that I say throughout a lot of my videos, because I feel like that's a really important thing that a lot of Black people maybe do or don't know. And so, for the first intervention to, I'll give you guys my way to, I guess, sort of get around that if you can. It would be, to try to make sure that your primary care doctor and, really all of your healthcare team, if you can, make sure that they are black, you know. um because the thing is, like, they don't, not only do they not talk about it with like patients or whatever, they don't even talk about it amongst, like, when we're, like, in class, or when we're, having a board meeting, or they don't they it's never mentioned, because it's kind of this thing that they, in a way, it seems like they want to look over. It's something that they kind of don't want to fix. In fact, a lot of the times, and I've seen this before, where non-black healthcare professionals would bring up sarcoidosis and start laughing. Like, they talk about how it's prevalent in black women and literally make a joke about it. So it's important to understand, kind of who you're dealing with, when you're, especially when it comes to your health, and it comes to your medical treatment. um but yeah, so I mean, it's like that, like, people, they don't want the best for everybody sometimes. So that's mostly what I had to say about it. Obviously, if you have sarcoidosis, or if somebody has sarcoidosis, um my first recommendation would be to definitely examine what your environment is like. Make sure that you're not being exposed to any caustic or harsh chemicals, or um, any industrial type things like nails, or nail salons. But and then the second major thing I would say is, try to develop a good relationship with a black physician somewhere, and kind of make sure, or, and I'm not gonna say that black physicians are, just gonna definitely be on your team, because I've actually met a lot of black physicians that I based off of their actions, based off of their words, based off of just their being, they would prefer to not have anything to do with other black people. So I know that that's a reality as well. But if you can find a decent, um physician, period, uh do that. And that's really important. A lot of people think that all doctors are kind of the same, or, um just because doctors took a Hippocratic oath to, provide treatment and not mistreat patients and things like that, that they always do that. But I will say that the way the medical system is set up, I'll tell you, I've seen for myself, doctors get around that all the time. Like, I mean, and then it's kind of, it's really up to the doctor, like, what goes down, or, what happens with the treatment and stuff. Like, nobody else really has um a lot of say so in what happens next to the patient, or things like that. And that's for a good reason, because the doctor's the one who's trained. The doctor's the one who's supposed to, know what's going on, and, be the one that kind of figures out what the strategy is to deal with the disease or whatever. But I will say, sometimes doctors abuse that power. Well, a lot of times doctors abuse that power, and a lot of times um it doesn't go, it's not noticed by anyone, because, of course, the doctor's not going to say, oh, I didn't prescribe this medication, or I didn't tell the patient to stop doing this, or I didn't do that, just because I don't want this patient to get better. And that's but that's the reason why they did it. Um so yeah, I just wanted to make this quick video, this half introduction, half discussion here. I want to hear your thoughts. Please leave comments. Please subscribe. Um, talk to your family, talk to your friends about their health. Make sure that you get the information that you need about different diseases and things. But yeah, so that was today's discussion of race in medicine. Um, and I will be making another video soon to have another discussion with you guys again. Thank you.